It's a reaction to a medicine in which it affects the whole skin, including sometimes very disturbing for the patients are like few of them like psoriasis, which you mentioned.
Doctor, when it comes to aging, the aging process can manifest in different ways, from dry skin to wrinkles.
Nobody wants to age. Dark circles have actually increased. So many patients come with us nowadays, and when a patient comes with acne, we initially try to tell them what are the do's and don'ts.
Glutathione, often hailed for its skin brightening properties, has gained popularity.
Glutathione is there everywhere now.
Welcome guys, in today's episode we have Dr. Asha Doshi with us, one of the renowned dermatologists in our country. In today's episode we are going to discuss about the basic skincare and also the skin treatments related like acne, dark circles, how we can prevent these things and certain skin treatments as well. This conversation is gonna be a free consultation as well. Enjoy the episode. Dr. Asha Doshi, welcome to Podswell.
Thanks, Aaron, to invite me.
Doctor, it's great that we are shooting this episode. To kick things off, can you share about your background, your journey, and the passion of being a dermatologist?
See, basically, I started my journey as a dermatologist way back in 1996. Actually, I was always passionate about the subject because my dad had a severe dermatological condition called as Steven-Johnson syndrome, and it was only a dermatologist who had saved him. So when I finished my MBBS, I got into dermat and I did my studies from Grand Medical College.
Doctor, I would just pause. Could you elaborate what was the sickness basically for the listeners?
Steven-Johnson syndrome is a condition in which it's a reaction to a medicine in which it affects the whole skin, including sometimes even the eyes and the nails. So my dad was given injection penicillin, which was very new at that time. It was way back, many years back, and then he reacted to it, and he had severe blisters all over his body, and his whole skin had peeled off completely. And he was very critical, but he was saved luckily, and it was a dermat who had saved him. So it goes back from that time that I always wanted to go for this profession.
Okay. Doctor, any challenges you faced in the early stages of your career?
Initially, like, see, nowadays the dermatology is a very rosy field because there's cosmetology added to it. But when I began my journey, it was pure dermatology in which we had to study everything about skin, hair, nails, even STD, sexually transmitted disorders, HIV, and everything. So when I was studying in Grand Medical College, we had all these severe cases of skin disorders, even leprosy, even HIV patients, which we had to see. So initially it was little tough because had not seen such it wasn't a rosy picture at all. Like, we had to really see a lot of cases which were difficult to treat at times, but then gradually, since it was my passion, so I really enjoyed doing my studies initially, and then the challenge came when I had to start my own practice. So when I started my own practice initially, I wanted to even learn a bit of cosmetology because it was very, very new. So I joined a renowned dermatologist and cosmetologist, Dr. Rekha Sheth, and she has been my mentor. Whatever I am actually is because of her. She has really trained me in both general as well as the cosmetic dermatology. I worked with her for almost 11 years before I started my own.
Doctor, now you're the founder of FINA, the Fine Finish.
No, it's FINA the Fine Touch.
Okay. So, doctor, what was that challenges you faced while starting your own clinic?
When I started my own, that time initially there was a little challenging because I was working for 11 years. I was under someone, and I had to just see my patients with all my dedication come back. But here it was like managing the whole clinic, having new staff, having new instruments in our dermatology. Our instruments, lasers, and all are very expensive. So that was a challenge, but we managed. We took financial help from the banks, and we started our new clinic. And by the grace of God and with the mouth spread, we really got good clientele. Now it's been almost 12 years, and we are really doing good.
Doctor, that's really inspirational. Moving forward, basically, minimal skincare regime is become really important in today's day. What are the basic skin maintaining tips you would give to the listeners?
For healthy skin and hair, you have to follow certain basic things. It's just not only the products, but even a good healthy lifestyle. So what I believe is, like I always tell my patients, even if you follow simple things, like for skincare, I always tell them the first basic thing is you have to use a very good face cleanser and a body wash to keep your skin in a very healthy condition. It should not become dry or it should not become very oily. So a good cleanser. Secondly, followed by a good sunscreen, especially on the exposed areas like face, neck, arms, whichever parts are exposed to sun, or even if you're indoors but under lights in front of laptops, you have to apply sunscreen every single day, at least once in a day, with a minimum SPF of about say 30 and a good moisturizer. Either if your skin is dry, you can apply both the times or at least once at night time.
Thank you, doctor. Great information. Moving forward, doctor, in your practice, you cover a wide range of general dermatology services, including treatments for psoriasis, vitiligo, eczema, and more. Can you share some insights into these common skin conditions and the advanced treatments you offer?
See, general dermatology is a very broad category. So, under that, lot of skin conditions come. But the most common conditions that we see in a day-to-day practice, and which is again very disturbing for the patients, are like few of them, like psoriasis, which you mentioned. So, it's a dry skin condition in which there is lot of scaling, and patient really feels embarrassed to go out with those plaques and scaling and all. So, vitiligo is again till now, it's thought to be a social taboo. No, it is not contagious, nothing, and it's lot of new molecular and biological molecules which are available with lot of treatments like eczema, laser, and PUA therapy. This condition is treatable. We do a lot of melanocyte transfers also. That also helps in this vitiligo patients. Then another condition which is very common is melasma, that is hyperpigmentation, which so many patients come with. Photodermatosis has become very common. So like we have IPL lasers, like that is intense pulse light lasers. We have microdermabrasions. We have a lot of other oral and topical newer molecules which have come, which giving wonderful results in such cases. So if you tell me general dermatology, it's like a wide. I mean, there's endless list of skin conditions, skin, hair, nail. Basically, dermatology consists of everything. There are a lot of autoimmune conditions like alopecia areata, lichen planus. So many cases are coming up nowadays, especially with our lifestyles that we are dealing with.
Absolutely. Doctor, when it comes to aging, the aging process can manifest in different ways, from dry skin to wrinkles, as we mentioned. At FINA, you provide a range of anti-aging treatments such as Botox, fillers, and laser skin tightening. How do these treatments work, and what can individuals expect in terms of results?
See, the aging has become a big word, and nobody wants to age. Honestly speaking, everybody wants their skin, their hair, everything to be absolutely perfect. Especially with increased exposure to media and Insta and Facebook, there are so many things which are coming up like DIYs and so many information about new technologies. So even I have like people who come in 20s and early 30s. They say, "Ki, doc, I don't want even a single line. I don't. My skin is sagging." So anti-aging has become a big thing. Though there are a lot of procedures, like as you mentioned, Botox fillers and all, we categorize according to the patient's need. Like if it's a young patient and if the patient is in media, then we promote these procedures. Otherwise, normally we start with initially, of course, oral medications like collagen supplements. Then there are certain anti-aging creams with retinol and hyaluronic acids. Then we also tell them to use certain procedures which are safe and non-invasive. Like we do chemical peels, we can do even microdermabrasion with electroporation, MNRF, that is microneedling, radiofrequency tissue tightening, and certain lasers. Then if the patient is in the age group of say 35 to 40 and they have started developing a lot of lines, wrinkles, then we advise Botox, that is botulinum toxin injection, which helps to relax your muscles. So with age, what happens is because of our facial expressions and all, our muscles they start contracting. So you get different types of lines, which are some are static lines, some are dynamic lines, especially the forehead and the crow's feet and all. So then we give Botox in those cases. But then these treatments are like we have to repeat at regular intervals. So we counsel the patient accordingly, and then we start. Fillers are the injections with hyaluronic acid, which is hyaluronic acid is a normal substance of our skin, which is present in the dermis, which is like a glue-like substance which holds the collagen and elastin fibers, so which gets depleted with age. So we fill that, as in how we start getting the folds, like laugh lines and marionette lines, and if the skin
Hmm.
is sagging, so we give little fillers to lift up the skin. So depending upon the patient's age and requirement, we give the treatments. So there are certain patients who are in their late 60s and all, so they have a lot of sagging. So we have non-invasive procedures also for them, like high intense focus ultrasound, HIFU treatment, in which we are doing the machine treatment to lift up the tissues.
So, doctor, basically, when these treatments come, it depends from which age group the patient is.
Yes.
Okay. Doctor, as we proceed, coming to dark circles are a common concern for many. What are the primary causes and how does FINA treat dark circles?
Dark circles have actually increased. So many patients come with us nowadays, and it has we are seeing a lot of increasing trend, especially because of too much of exposure to mobiles and laptops. From beginning from the small child to the adult, everybody is hooked to the media. So when you're having too much of exposure to these things, plus if your lifestyle is not good, that is if you're sleeping very late or if you have any other deficiencies, they can also cause dark circles like anemia and all. So there are a lot of causes for dark circles. So initially when a patient comes, we take their whole history at our clinic to find out what exactly can be the underlying cause, because if it's an underlying cause like a deficiency of hemoglobin or anemia, we have to correct that. Just giving creams or treatments might not help, and it might again recur back. So we first find out the cause. We try to treat the root cause and then advise external treatments like certain under eye creams, and in the machine treatments like Acugel, which is like a machine in which we apply a serum and move the machine around the eye. So it helps to improve the circulation in that area. It helps to break the melanin in the melanocytes, and that extra pigment gets washed out and improves the quality of the skin and reduces the dark circles there. So that is one of the treatments. We even do certain peels, under eye peels, which are also giving good results. Chemical peels, the name chemical peel sounds very big, but they're very safe. We use gel based peels which also hydrate the skin around the eyes, like lactic acid peels and all. And we also have nowadays pico laser, which if used properly by the dermatologist, it gives good results.
Okay. Coming next to acne and scars. Acne is a prevalent skin condition, often leaving behind scars. And also, does diet play a role in preventing scars?
Acne is a very common condition. Initially, we used to have only teenagers. Nowadays, we are seeing so many, even in the age group of 30s, 40s, they still have acne. So, it is, I feel it's more of a lifestyle disorder. And plus, of course, hormonal changes also play a major role, especially when it's a growing child. So, when a patient comes with acne, we initially try to tell them what are the do's and don'ts, especially with the diet, with the exercise, with the sleep patterns, because all these things matter. So in our clinic, we have a history form, so we note down all these things from the patient, and then we try to correct that first, because having excessive sugar or carbs or chocolates or oily food, everything is going to contribute to acne. And once we counsel regarding that, we also counsel that how they are supposed to take care, starting from the cleansing part. That is, they have to wash their face twice in a day so that extra oil gets washed out, especially with salicylic acid face washes. Then after they have washed their face, they have to apply certain oil free moisturizers, otherwise the skin again gets very dry, and the creams for the acne. And most important thing is counseling for them not to prick the acne, because that is one of the commonest cause to give acne scars in future. So after that, we give the medication, and if required, the external treatments in the form of chemical peels. We have lasers, like which help in decreasing the bacterial load in the oil glands to reduce the acne. We also have certain treatments like for the acne. Once they get the scars, we have lasers which also act to reduce the fibrosis and to bring the tissues up, so that the scars are also leveled up. So it depends at what stage the patient is coming. If they have active acne, we treat that. If they come at the stage when they have no active acne but only scars, then we give the scar treatments.
Sure. Doctor, as we proceed towards the last segment of today's podcast, glutathione, often hailed for its skin brightening properties, has gained popularity. Can you shed light on how FINA incorporates glutathione treatments into skincare routines?
Glutathione is there everywhere now. Basically, it's actually, what is glutathione? It's an antioxidant which was given to liver cancer patients as an injectable. And when it was given, the patient started getting fairer. That's how it came into the cosmetic industry. And now we are using it in a particular dose, which is safe enough to give the skin lightening. And at the same time, it also acts like an antioxidant. So if given in a proper dose, it works very good for skin lightening, a generalized tone lightening. And there are different forms in which we give glutathione. So it's in the form of oral medication and injectables. They're also available nowadays in face washes and creams and all. But the major glutathione, the form in which it mainly works is mainly orally or by IV injections. IV injections also have to be given very safely under the guidance of dermatologist, because what happens is sometimes the patient may react to certain molecules. So we have to do it in a proper clinic setup. Like there are so many places where we are seeing that they are just giving us, anywhere and everywhere the IV lounges are there, but it has to be done under proper supervision and with the proper FDA approved glutathiones, because there are a lot of glutathiones in the market. It does help in reducing the pigmentation. There is a myth, if I take glutathione, I'm going to become fair. Yes, if you're originally fair, you're going to get back your color. But if you're originally, say, on a wheatish side, you'll get the fairer color. But if you stop, you may go back to where you were. So that concept has to be taught to the patients that you can take it, but if you want to continue that skin tone of yours to from wheatish to the fairer thing, then you may have to keep taking at regular intervals.
Doctor, so basically glutathione brings back the original skin color.
If you're fair and if there is no underlying metabolic disorder which is making you dark. Otherwise, if it's just because of tanning or over a period because of, say, certain use of certain cosmetics that you have become on the darker side, then you get back your original color.
Great. Thank you, doctor, for enlightening us with the diverse aspects of skincare and the advanced treatments. It was great having you on the podcast.
Thank you, Aaron.
So, guys, that's it for our today's episode. Hope you all have gained most of the insights related to skincare. And also, Dr. Asha Doshi is gonna return on the podcast on various other dermatology related topics. Yes, by the way, I've noticed that you guys haven't subscribed to the channel. So, hit the subscribe button and please do share it with your loved ones. This is Aaron Fernandez signing off.